This is how you determine exactly which type of hearing aid you need. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm going to teach you the 4 things you need to consider when trying to determine the right type of hearing aid for you. A quick search on the internet will yield thousands of results for different types of hearing aids. And of course, if you read the descriptions and the marketing materials for all of these different hearing aids, you'll soon find out that every single one of them is the best hearing aid in the world. The problem with this is that it's clearly impossible for every single hearing aid to be the best. So how is it that hearing care professionals are able to determine which hearing aid is right for you when there's virtually unlimited options to choose from? Well, that is exactly what I'm going to be revealing in this video, but before I do me a huge favor, click the like button, really helps out the channel, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well, it's greatly appreciated, and a huge shout out to Oticon for sponsoring today's video, but more on them in a little bit. Also, let me know down in the comments section which things are most important to you that you look for in a pair of new hearing aids. That being said, the first thing that a hearing care professional will look at when trying to determine the best hearing aid for you is your hearing loss severity and configuration. This is definitely the smartest first step when trying to determine which hearing aid you're a candidate for. Without understanding severity and configuration, it's virtually impossible to determine which hearing aid is most appropriate for you. Let's start by talking about severity. When you look at an audiogram, the X's represent the hearing sensitivity of your left ear, and the O's represent the hearing sensitivity of your right ear. The further down you see these markings go on this graph, the worse your hearing is. If we put up severity overlays, you can see that depending on where these X's and O's fall, will indicate how severe your hearing loss is. If they are within this range, then you have a mild level hearing loss. If they are within this range, you have a moderate level hearing loss. And the same is true for moderately severe, severe, and profound levels of hearing loss. When selecting an appropriate hearing aid, you would not want to pick the same hearing aid with the same amplification levels for a profound hearing loss as you would for a mild level hearing loss, and vice versa. Right off the bat, your hearing loss severity will eliminate a ton of different hearing aid options. Of course, in addition to the severity of your hearing loss, you also have to consider the configuration of your hearing loss. For instance, if you have a high frequency hearing loss, you need to make sure that the hearing aid you're going to be using is capable of hitting high frequency prescriptive targets verified with real-ear measurement. Some hearing aid styles are not very good at treating high frequency hearing losses, but other hearing aid styles are excellent at doing so. Flat hearing losses, where you have a hearing loss in the low, mid, and high frequency ranges, potentially need a different style of hearing aid set up a completely different way. And if you get the hearing aid selection wrong, it doesn't matter what you do from a programming side of things, you will not be able to make that hearing aid work optimally. Once a hearing care professional has considered both the severity and configuration of your hearing loss, they will then need to look at a second variable, which is different hearing aid features. Some hearing aid features can be nice to have, and other hearing aid features are an absolute mandatory requirement, and these are different for everybody. For instance, if you have finger dexterity issues, it's a much smarter idea to go with a hearing aid that's rechargeable than going with a hearing aid that uses disposable batteries. Not only is it almost impossible to open a package of disposable batteries nowadays, but it's also very difficult to change those really small batteries inside of these hearing aids. Same thing is true about Bluetooth connectivity. If you struggle hearing and understanding speech on the phone or understanding dialogue on the TV, streaming the audio from your smartphone or from your TV directly into your hearing aids is a lifesaver. You also have artificial intelligence that makes it possible for you to hear better in background noise situations, even if you have really bad hearing and background noise. Hearing aids with a deep neural network that uses artificial intelligence to separate speech from background noise is a huge advantage over other hearing aids that use man-made algorithms to try to do the same. And depending on where you live and how much you expose your hearing aids to sweat, debris, and moisture, the IP ratings of your hearing aids may also be a top priority if you want your hearing aids to continuously function without having issues. There are almost unlimited hearing aid features to choose from, but they should be selected based on your unique individual needs. But in addition to your needs, you also have personal preferences, which is the third thing that a hearing care professional will consider when trying to determine the right hearing aid for you. Preferences for style, fit, feel, and functionality can all sway the decision on which hearing aids you should be going with. Some people do not want their hearing aids to be seen, while other individuals do want their hearing aids to be seen, and they want those hearing aids to stand out so the person they're communicating with knows that they have a hearing loss and needs to make accommodations. Some individuals do not have a lot of room behind their ears for hearing aids and would prefer their hearing aids to go all inside of their ears. Some individuals prefer to use a rubber dome on their hearing aids, and others prefer custom ear molds. And a lot of people really want their hearing aids to connect with a smartphone app so they can make their own adjustments much more easily than trying to find a push button to make adjustments. And Oticon, today's video sponsor, has a full portfolio of devices that cover virtually every aspect of your hearing loss, needs, and preferences that I just discussed. The Zeal is a discrete in-the-ear option that fits into your ear canal but does not give up any of the features that you would get from a receiver in the ear or behind the ear style of devices. It's rechargeable, it has wireless Bluetooth connectivity to include Auracast, it can be fit with a rubber dome or a custom ear tip, it uses Oticon's second generation deep neural network for artificial intelligence separation of speech and noise, and it's incredibly durable thanks to Oticon's new encapsulation technique that keeps the device small and protected from moisture and debris. The Zeal hearing aid is great if your hearing loss thresholds are 75 decibels or less on your audiogram. If you have more hearing loss than that, then you may want to consider the Oticon Intent. The Intent Mini Right R is Oticon's rechargeable receiver in the ear option that is suitable for all levels of hearing loss ranging anywhere from mild to profound. The modular nature of the Mini Right R allows your hearing care professional to change between different receiver strengths depending on the severity of your hearing loss and use either a rubber dome or a custom ear mold to make sure that they're able to amplify the sound appropriately inside of your ear canal. If your hearing loss becomes worse over time, then your hearing care professional can actually change the receiver wires to accommodate your new level of loss. Or if you need a behind-the-ear hearing aid, otherwise known as a BTE, your hearing care professional can select the Oticon Intent Mini BTE-R. The Mini BTE-R is rechargeable and uses either a slim tube or a size 13 tube with a custom ear mold. These hearing aids are great for children who have changes in their ear size over the years and who need a hearing aid that can adapt to their changing needs as they get older. BTE hearing aids are also great for some adults who have draining ears where you need to remove the receiver electronics out of the ear canal and put it into the body of the hearing aid so it doesn't constantly short out due to moisture issues. In these particular cases, the Oticon Intent Mini BTE-R is a terrific option. And you may have noticed a theme that your hearing loss, your needs, and your preferences all change over time, which is the fourth thing that your hearing care professional needs to consider when selecting the right hearing aids for you. In my opinion, a really good hearing care professional will not only be able to identify the perfect hearing aid for you right now, but they will also be able to predict your needs into the future. Anytime I'm going to be treating one of my patients' hearing loss, I'm always thinking about what they might need 5 years in the future because I know things will change. For instance, if you have a rapidly progressing hearing loss, I had better select a hearing aid that allows me to treat that hearing loss if it becomes more severe in the future. If I suspect that you may need a particular hearing aid feature like Bluetooth LE audio or Auracast, I need to make sure that the devices I dispense to you now are going to be able to do that in the future when you need it. Otherwise, in order to get a hearing aid that can accommodate your future hearing loss, you're going to have to purchase new hearing aids before you would have otherwise. And just so you know, it typically takes me anywhere between 90 minutes and 2 hours for an evaluation and consultation with a patient before I really know which hearing aid is right for them. It also means that hearing care professionals need to constantly stay on top of all the technological advancements that are occurring on a daily basis. That is, if we're going to be able to select the best hearing aid for you. And if we do, it is highly likely that we will be able to select the right hearing aid for you not only right now, but many years into the future as well. But I want to know what you think. Do you think that you have the absolute best hearing aid for you at this moment in time, or do you think you need to go back to the drawing board to find a better one? Let me know down in the comment section, and I'll see you in the next video.